So it's March 25th. It is. It's almost been 7 months that I've been out and living out. And in 9 days, I have a doctor's appointment to go and check my immune function and see if it's gotten any better with the adjustments that they've made to my medications. And I've been trying to eat so healthy and trying to just make my body the best body that it can be for what I'm living in. And I've still been keeping up with like the natural transition regimen, like with the DHEA and the ZMA and the Tribulus and the vitamin C. And I know some of those things also are immune supplements as well. I really like eggs, and I've been eating eggs, but I've been eating eggs like with the omega-3s, and that's an immune supplement. And so I've been trying to do the things that I need to do to try and keep myself as healthy as possible and try and boost my immune system. So I go to see my doctor in 9 days, and there's a couple of outcomes that can happen from that. My immune test comes back, and they've gotten drastically better. And if they've gotten drastically better, then we can kind of do one of two things. We can go straight away and go on T, because if they've gotten drastically better, then we know it was that one medication that I've been on that was killing my immune system, and obviously we can't go on that medication. But the problem with that is that without that medication, it's a bipolar mood stabilizer, and I have been really unstable with my moods. I've been like chronically anxious to the point of some days not even able to leave my house, to the point of some days not able even to leave my bed, fearful of opening the front door even at 2 a.m. that there might be somebody out there. And there's no reason to fear any of those things, just my social anxiety. Even with taking my anxiety medications, like my rescue medications, I take Klonopin. Even with taking those things, I've had to leave meetings and things like that, just up and just walk out right in the middle of them, no explanation given, because I couldn't even bear the thought of, like, you know, saying goodbye, or like, oh, hey, look at the time, I've got to go, do things. No, I just like stood up and walked like I was going to go to the bathroom or something, and just didn't come back. Yeah, that's with my anxiety medication. That's well controlled. Just because what happened was we were supposed to have it inside of a coffee shop where I felt comfortable, and the coffee shop was closed, and so they're like, oh, well, let's just go next door to my friend's house, and we'll have it in her living room. And the change of venue it just blew my mind so much. Like, I couldn't stop freaking out. Like, I'm in this stranger's house. I'm in this stranger's house. Like, I don't know this person really well. Like I've met her. I knew her. Like, I knew of her. Like, I knew her name. But, like, I'm in this stranger's house. I've never been in this place before. Like, I was freaking out to the point of, like, if I freak myself out so much, I will actually fall asleep. Like, and I was freaking out to the point that, like, I was getting drowsy. And I know that it's not really logical, but that's, so anyway, if my immune system comes up and it gets better, then we have to decide between, yes, just going ahead and going into testosterone and trying to find a new medication. Hold on. Sorry. And finding a new medication to substitute for the one that's killing my immune system, and that would probably be the healthiest thing for me. And then as we go on the testosterone, we'll monitor, when we monitor my T levels, we'll go ahead and monitor my immune system levels, and making sure that my testosterone doesn't decrease the immune system as well. If we go in and the immune levels are exactly the same, then what we'll do is we'll go ahead and probably put me back on the medicine that we were thinking that might be causing the immune problems, because obviously if they're exactly the same, then it's not causing the immune problems, and I need that medicine in my life because I was functional with it, and I'm not functional without it. Or I'm minimally functional without it. Like, you don't know how churned the waters are under the still surface, you know? And if the levels are exactly the same, then basically the levels have been low, like dangerously low, but I haven't been getting sick for a year. They've been dangerously low, but I haven't been showing any symptoms of it. And so I'm going to pressure my doctor, and like, my doctor's been on board. He's been saying, you know, let me know when you want to start T, let me know. And it's been me saying, well, let's look at this, let's check with the immune system, let's do more tests, let's be careful, let's da-da-da-da-da. I'm at the point now where, like, I don't want to hold off anymore. Like, we've done all the tests, we've done all the checks and balances, and we've looked at everything, and I'm still not getting sick. So I think that if the levels are still the same, and they haven't dropped any lower than what they were, then I'm going to say, alright, now it's time to experiment, because, like, I'm not getting any sicker. Like, I'm staying the same sick without any symptoms. I'm staying the same. And so let's go ahead and let's start T, and let's check me out. Let's keep an eye on everything, and let's make sure I'm not getting any sicker on the T than I have, you know, consistently been. Chronically ill, but healthy. Like, I have a severe disease apparently, but I'm healthy. I mean, it's the same thing, like, you know, you have severe bipolar disorder, but if you take your medicine, like, you don't end up in the psych ward. You have chronic disease, but you're healthy. Okay, well, I have these low numbers, like, but if I'm healthy, then there's no reason to treat me like, you know, I should be in a bubble of immune suppressants, you know what I mean, or immune boosters. Like, if I'm still healthy, so then I'm still going to say, you know, it's time. It's time. So I'm going to go in there. Like, I've already given him the WPATH guidelines for how to dose testosterone and how to treat transgender patients. I'm his first F to M. He's had male to female transgender patients before, but I'm his first guy. And so he's a little bit new dosing testosterone. So this is going to be a new experience for both of us, but I'm going to go in there with my numbers and my expectations, and we'll see how they meet up with his. And hopefully, on 9 days from now, I can leave with a script that day. If not, then we'll make an appointment probably for about a month from then, and then I'll leave with a script then. Or maybe even sooner than that. But if I can go in with the numbers on a sticky note and say, listen, this is the script that you need to write, and if you write it just like this is the way it should be, and then I'll see you in a month, and we'll retest, and we'll readjust the doses. But, you know, I think that that's the way that would go. The third and least promising scenario is that we go in and we test my immune function, and that my immune function is dropped even further. If that's the case, then we'll probably put me back on the bipolar medicine, because obviously that wasn't doing it. That wasn't causing the problem. It wasn't making any of the issues, because taking me off of it didn't make anything better. It, you know, I got worse, but obviously not from that reason. So we'll put me back on that, and we'll have to wait and see, because if my immune function is worse, I'm obviously not going to be willing to play with the testosterone at this time. Because, again, this is my life, and I can't end up in the ICU. I can't end up, you know, missing work, and I can't end up, you know, losing my job, and losing my apartment, and losing my car, and losing my everything. As much as I'd like it for my sanity, with the natural transition, I'm passing more and more every day. You know, my coworkers are calling me Mr. Shea instead of Miss Shea, as a term of endearment. You know, how they'll come up and they'll be like, hey, Miss Shea. You know, they're like, no, hey, Mr. Shea. And, you know, it's not Daniel, but I don't go by Daniel at work. I go by Shay. It's my given first name, and even when I get my name changed, it'll be Shay Daniel. And, you know, it's a promise. It's a start. So even if I can't start testosterone in 9 days, even if worse comes to worse and they say no, we have to wait, or I make the decision, no, I have to wait for my own health, for my own safety, I'm okay with that. So I know this video has been really, really long, but I don't think I've made you one in probably a couple of months, so I figured I'd update you really nicely and really well. And God, sometimes my voice, it drops so low, like I'll just talk and like out of my mouth will come like this like deep booming voice, and I'll be like, oh yeah, that was me. And other times like I'll get excited and I'll do like the girly squeak voice, and I'll be like, oh, that was me. Yeah, I still sound like a girl. But testosterone, and then like hair, and like on my hands or feet or stomach or something, I don't know, and that would be fantastic. So who knows, if I get it, I'll definitely make you a video, and we'll see.